Opioids are the #1 cause of death in the United States for those between the age of 25 and 45, according to the latest numbers from Southeastern Idaho Public Health. Today, the Idaho Department of Health and Welfare relaunched a program that is looking to combat this issue. Local News 8's Evan Thomason shows us how they are trying to roll out the drug naloxone more effectively.
The opioid epidemic is a massive concern for the country. Although Idaho is performing better than other states, it is still a big problem.
Right now, the United States has like 32.4 people per 100,000 population that die every year, and Idaho's like 19. So we're doing better than the country as a whole, but it's still a huge cause of death, and particularly in people that have a lot of life left to live.
Naloxone is the #1 treatment to stop opioid overdoses. It is used as a nasal spray during emergency overdose situations. The Idaho Department of Health and Welfare announced Monday that they have reinstated their statewide naloxone distribution program. They had some complications with their previous contractor that forced them to suspend the operation until they were able to find a new provider.
The legislature provided us some direction through intent language that kind of sets parameters around how they want us to contract for this. It's taken us a couple of months to get this thing stood up, but we feel really good about where we are in our contract with Kootenai Fire, who will fulfill the contract in a very similar way to our past contractor.
The state program will only provide naloxone to a couple of connections.
Our contract can only be with a first responder organization, but that first responder organization can distribute it to others that request it.
Anyone from schools to hospitals to bars can then receive a free supply of naloxone through their local sheriff's office or fire department. Local health experts say people should have naloxone spray in case they need to help someone in need.
I've heard of a story of a gal that was coming out of her child's daycare and she found someone unresponsive next to their car and they were having an overdose. So she wasn't expecting that. She had it on her person or in her car and she was able to save a life.
With Local News 8, I'm Evan Thomason.
And we also talked with one of our local health providers about the effects of ketamine. There has been a lot of talk recently since it was discovered that Friends star Matthew Perry died due to ketamine. It is a drug much like opioids, but it is usually not as addictive and common. Ketamine is a pain reliever and a sedative that is typically used for surgeries. Some doctors are now trying to prescribe it as a last resort medicine for depression. The main effect is to get users to slow their breathing. The side effects, though, can be devastating.
As far as like overdose deaths, we're more concerned about opioids than we are about ketamine. But ketamine has this interesting mode of action that sort of increases people's demand for oxygen, makes their heart beat faster, increases their blood pressure and pulse. And it also kind of suppresses people's breathing. So it's making them need more oxygen at the same time that they kind of suppress how much people want to breathe.
He tells us that while he sees about 20 patients daily having problems with opioids, he sees maybe 1 or 2 ketamine patients weekly.